Hello everyone, Suparna. Welcome back to my channel Suparna Speech Therapy Clinic. Today I would like to make an announcement, that is from today I will be doing my videos in English too. As per the request from my well-wishers, friends, my subscribers, they have been requesting me since a long time to do my videos in both the languages. Due to some time constraints, I couldn't do in both the languages. So from today I thought I'll start doing it in both English and Malayalam. I'll try my level best with my best of my knowledge also. So in the last video, if you have watched, I have discussed about the speech and language delay that you see in children. So today I would like to discuss about the assessment part of it, like how you can find it out at home and how do we, the speech language pathologist, assess it at our clinical settings or hospital settings. So basically, usually the parents come to us with a complaint of the child is not speaking as per the peers, or my child is not speaking as per the child who lives next door, something like that. So basically what you assess at home is you do comparison with the new parents do comparison with other children who stay near your place or with the cousins. Okay. So once you find out that your child is having speech language delay, what you can do is you can directly come to us. Of course you can come to us to the speech language pathologist, or you can consult a pediatrician or an ENT, and then they might refer to us. But unfortunately nowadays we don't see the pediatricians referring children to a speech language pathologist. What they recommend is that they ask the parents to send the child to a play school, and there after mingling with the children at play school, the consultants say that the children will acquire language. That is true only to a certain extent, because children will acquire language once they interact with peer group, obviously with the peer group and with others. But in some children, if you find there is delay, they need to have a speech language therapy assessment, and if necessary a therapy session. Not only a therapy session, maybe therapy sessions. So it is basically you can go to a pediatrician, and then I would suggest you can directly come to us. If you know a pediatrician, you can go to the pediatrician and then come to us. Pediatricians do refer to us, that is they do refer to us, but I would suggest you can come to you can attend speech language therapy. Along with that, you can put this child in a play school where the child will be exposed to his peer group, and the child will get an opportunity to interact with the peers. So once the child or the parent comes to us with a child having a speech language delay, what we do is we take a detailed case history, which includes the birth history, the prenatal history, perinatal history, postnatal history, the sibling history, all the if there is any family history, all the details, and a complete detailed evaluation. And we come to a detailed evaluation. In that we assess the oral cavity, all the structures in the oral cavity like the teeth, tongue, lips, etc. And then we do we come to a speech language assessment where we see the child's pre-linguistic skills like the eye contact, attention, all those skills, and then we come to a linguistic skill assessment, and in that we use a certain test materials or batteries, in which it is basically a questionnaire form of questionnaire, in which we ask the patients or the not the patients, the parents, or we make the child do some activities, and thereby we assess certain things in the child. That is basically we assess the receptive language of the child and the expressive language of the child. And what we do is we find the chronological age of the child, that is the biological age of the child, and in the test material what we are assessing is the receptive and expressive language delay that the child exhibits. That is, we compare the child's receptive expressive language delay with that of a typically developing child. As I always say, the language skills are assessed, or we mention the language skills in an age range. We can't specifically say that at 9 months or at 10 months. It is in a range that we assess the language skills. So basically these test materials are also given in a certain interval or in an age group, like an age range. So what we do is, once we find the chronological age of the child, we start assessing till we find the receptive language age and the expressive language age of the child who is in front of us, or the child child whom the parent brings. So, from that we assess the receptive language age and the expressive language age, and thereby we find it out whether it is just a receptive expressive language delay, or either it is a receptive expressive language delay or it is a expressive language delay. And the diagnosis is based on the test batteries that we conduct in a therapy setting or a clinical setting or in a hospital setting, and thus the child is diagnosed with a label. So, once the assessment is over, we do counsel the parents regarding the importance of speech language therapy, the importance of parental involvement, the importance of home training, and there we like decide the frequency of the therapy sessions and how frequently the child should come for therapy. The therapy is not for just some months or like weeks. It might get extended, like it depends on various factors like the potential of the child, the home training that you provide to the child, and the speech therapy session, that is like the skill of the therapist. That is, these are the factors that like decide the prognosis or the improvement of the child. So, once you decide, or once the child is like diagnosed with this kind of problem, the next thing that you have to do, or that we have to start, is a speech language therapy session. So, that this is basically an assessment part which will be like a little useful for you, but the management part is like will be more useful for you, which I will be discussing in my next video. Hope this video is informative to you. So, if you have any queries or any doubts, you can post it in the inbox or the comment box, and if you have any personal, if you need to do any personal discussion, you can do in my personal Facebook page, that is Suparna Speech Therapy Clinic. You can inbox there, and please like and share and subscribe my channel, Suparna's Speech Therapy Clinic. Thank you.